is Mountain Health Today. I'm Ted Owens, your host. This program is brought to you by the Tahoe Forest Health System, serving the greater North Lake Tahoe area. And my guest host today is Dr. Brian Evans, Chief Medical Officer of the Tahoe Forest Health System. Brian, I'm so glad to have you here. Thank you for making the time.
Thanks for having me, Ted. I appreciate it.
Today, Brian, we're going to be talking about ski season, something appropriate for the folks at home. And we're going to talk a little bit about physical therapy and orthopedics. But first, just so that the folks understand who you are and what you do, I know you spent many, many years as an ER doctor. So if you could share a little bit about that, and then we'll talk a little bit about what you do today.
Absolutely. Yeah, I spent 15 years working in the emergency department on the western side of Nevada County in Grass Valley. And so I've definitely seen my fair share of ski and snowboarder injuries over the years.
Well, probably mountain biking,
Yes.
rock climbing, golf.
Golf. Yeah, not as common as mountain biking and skiing and snowboarding. That's for sure.
Dangerous sport. Okay. Later, you decided to get into the administrative side of things. Many of the folks at home probably don't understand what a chief medical officer does. So let's find out what you do.
Well, you know, chief medical officer is a common position in hospitals and healthcare systems. And what I'm really responsible for is the quality of care that is provided for the patients of our community, making sure that we provide outstanding, safe patient care to everybody that comes in, whether they're coming into the emergency department, having surgery at the hospital, seeing their primary doctor. And so we ensure that the quality and the safety is there, and then also making sure that we provide access to care for our entire community. So it's a much broader thing than seeing one patient at a time in the emergency department, but it's very important and satisfying.
Well, so in your role, a leadership position, you've got to forecast what's coming up. And in our case, we have winter and winter sports coming, and they're going to bring a whole slew of types of things to deal with. But as it relates to your skeletal concerns, how do you prepare for the winter? What do you recommend the folks at home do to prepare?
Well, first of all, skiing and snowboarding are wonderful sports, and I've participated in them for many years, and I enjoy them, and I recommend the sports to just about everybody. That said, there are multiple ways that you can get hurt when you're skiing or snowboarding, and there's a lot of ways you can help prevent accidents. First of all, you want to be in good physical condition. You want to make sure that you train for the winter season so that you're in good physical shape and not overdoing it. We see a lot of people who would fall into the category of a weekend warrior. You know, they haven't really done the proper conditioning and stretching and that sort of thing. They're not in the right kind of aerobic activity or condition, so that when they do end up hitting the slopes can hit them right back. So we just want to really make sure that people are doing that. I want to make sure people ski and snowboard carefully and safely. They're not overdoing it while they're coming down the hill too fast. They're aware of what's going on around them. And when they're starting to get tired, they're getting fatigued, they should probably call it a day. I would also say that people should really think about the conditions that are on the mountain. We see more injuries when it's icy. We see more injuries when it's crowded. So a crowded Saturday when it's sunny but icy, that's kind of a recipe for injuries, and we just want to make sure that people are aware of that.
Dr. Evans, I would think, and I think, folks at home will probably understand this as well, is your equipment's very important. And if you don't properly maintain your equipment, I'm thinking bindings very often, for example, they can be your worst enemy as well and cause what kind of injuries if, say, your ski bindings don't release you on a forward fall?
You know, you really want to make sure that all of your equipment is tuned up properly and they're inspected by somebody who knows what they're doing. And usually that implies going to a ski shop where you have trained technicians who can make sure that doesn't happen, certainly, and that the skis or the snowboard is really maintained to high condition, because you don't want your equipment to fail on you and that cause a crash. So just good common sense.
Well, I think it's important also for folks to understand that sometimes binding that doesn't release can cause a rather severe Achilles type of injury, yes?
It
not
can.
Not just skeletal.
Yeah, or a knee injury. And there's really, falling down, there's all kinds of injuries that can happen. We see some common things. We see a lot of wrist fractures. We see a lot of head injuries. We see a lot of knee injuries. But truly, when people start falling down the hill, a lot of different things can happen. So we see a wide variety of injuries.
And what I think I hear you saying is that there's a lot that we can all do preventatively to avoid these things in advance of hitting the slopes. The worst thing you do is just dust off the skis or the snowboard and go.
That's just it. It's good common sense. And, a lot of times people are tempted to try to follow their buddy or their younger kid who's maybe a better skier than they are and maybe take on terrain that they're not comfortable with. And so you really don't want to be put in those kinds of situations where you're in a situation that's just dangerous for you.
Well,
So,
it's not just following your younger kid or younger buddy. It's in your mind thinking you're 25 again, and
Right.
you can do what you used to do, and
Right.
it might not work out.
I don't want to put a damper on anybody's fun, but good decision making. And then also hitting the bar in the middle of the day when you're skiing is something I would be very cautious about, because alcohol and skiing can be a real big problem.
And that's very true. You get more relaxed, and getting relaxed might not be the best situation for you.
It really seems like we're ruining everybody's fun right now. And,
We are.
I feel
We
bad
should.
about
I
it.
think skiing is a great sport. Snowboarding is a great sport. But being safe is very important as we approach the ski season. So really what we're talking about is tuning up your gear,
Tuning up.
tuning up yourself, and staying within the bounds of your abilities, right?
Absolutely. Great summary. I couldn't have said it better myself.
Oh, yes, you could have. You did. So what other advice do you have for folks that might have a slight ski injury that might need some attention? Where should they go?
I mean, a lot of times people underestimate how important physical therapy is in recovery from a ski injury. And so you really want to get in early to get an assessment by a trained physical therapist, and then get on a program that is going to help you recover as quickly as possible, but safely as well, because we don't want folks to engage in activities that are going to delay their recovery, exacerbate their original injury, or just cause it to recur again. That is not what we want.
And we all just want to get back to what we like to do, which
Yes.
is hit the slopes and enjoy the winter. You've been watching Mountain Health Today. I'm Ted Owens, and my guest, Dr. Brian Evans. We've been talking about the upcoming winter season. Thank you very much for tuning in and listening. This is Mountain Health Today. I'm Ted Owens, your host, and this program is brought to you by the Tahoe Forest Health System. My guest host today is Dr. Brian Evans, Chief Medical Officer of the Tahoe Forest Health System. Brian, thanks so much for making time and being here today. I know you're a very busy guy.
Thanks for having me.
Well, it's wonderful to have you. We're going to bring on a guest today, Ryan Solberg, who is the director that manages all things physical therapy. And why don't you tell us a little bit about Ryan, and we'll bring him on.
Well, Ryan, it was great to meet Ryan when I came into the system, because he has a team of therapists that are unbelievable. I mean, there's just incredible expertise over there. They see thousands of patients with all kinds of conditions, tremendous variety. They're helping people get back from injuries. They're helping prevent injuries. They're helping people all kinds of things that are complex. A lot of the patients are, really nervous about what they've been dealing with their injuries, and they're so kind and compassionate and so well trained that they just do a fantastic job.
Well,
So Ryan, are you there? Welcome to the show.
Yeah, thank you for the great introduction, both Ted and Dr. Evans. Really appreciate being here.
Ryan, good to see you. I understand that nervousness that Dr. Evans is talking about. I've been a frequent flyer in your shop through the years. Tell us a little bit about yourself, what your path was, and why you chose physical therapy.
Yeah, so I had a pretty unique path as far as, I grew up in a family. My dad's a physical therapist. He also taught at the graduate school physical therapy at University of Pacific. They ran their own private clinic. My mom and dad, my mom was up front running the office. My dad was a physical therapist, and got to see it as a kid. And I actually was working in the clinic at a very young age, everything from folding towels to meeting a lot of the most amazing patients along the way.
There's a couple of different ways to look at physical therapy. Of course, some of it is preventive, some of it is a moderate injury perhaps, and some of it is post-operative. Tell us a little bit about the differences between the three.
Yeah, so your traditional rehab that, and this can go with both occupational therapy and physical therapy. If you're recovering, we actually have specialists in the occupational therapists here Most are all certified hand therapists, so they actually will see a gamut of all the hands and elbows post-operatively, as well as the PT physical therapists, ranging from all different body parts there. So your traditional post-op rehab, whether it's a minor injury management, will provide direct hands-on, one-on-one, all the instruction in the clinic. And that's really the traditional as we know, but really where therapy's evolved over the last, I would say, 5 to 10 years is taking more initiatives with injury prevention or injury reduction and education, for our patients. And it can be at that time of service, but also we really try to integrate into different, community, whether it's a resource, it's a retail contract that we may have with Palisades or Sugar Bowl Ski Academy, with the school districts. We really try to be proactive with our whole collective team to come up with some really good injury prevention services, such as annual testing that we do every year with the athletes. We do that same type of injury prevention testing with the ski team athletes and some of the contracts that we have. We try to integrate with the school districts in the BFIT program, teaching kids proper movement mechanics at an early age so they don't get injured once they go into those advanced sports that would require day-to-day practices. So we're really trying to penetrate into more education and spreading the word of our educating the individuals with how to move properly, how to go about proper stretching, strengthening specific to their sport.
Ryan, thank you for mentioning all those partnerships, and I know there's others. You guys are really integrated into the community, and that's one of the things that I think has made your programs so successful over the years. One of the things about our community is that we have a lot of very athletic people, very accomplished athletes. I know that your team is interfacing with those individuals every single day. What would you tell those athletes or people that are in our community that are high-achieving, high-performing athletes now about protecting themselves from injury, what to do if they do have an injury, and how to interface with your team, how to stay healthy and high-performing for the long term?
Yeah, that's a great question. And I think, we all, as individuals that have moved to the Tahoe area, are high-achieving athletes, and we're aging athletes with the same mission that we want to achieve our personal best. And we see that, and we want to be treated and we want to train like the champions, right? And we're literally living next to, probably 9 to 10 Olympians in our area. And that's a very unique opportunity that we have. And oftentimes they're in our clinics. They're interacting with other patients. And it's pretty exciting to see and find out what those individuals are doing and tap into that knowledge base as well, and really try to implement those same type of strategies into our daily routines and our physical therapy or occupational therapy programs that we set up for an individual.
If someone wants to find out more about the physical therapy department, where would you suggest they go?
Well, we have our website that is through Tahoe Forest Hospital District. You can go into the services and find our department. What's great is you can see all of our 3 outpatient clinics, and you can read all the bios of our therapists and read the long list of services that we provide. I have a list in front of me of about 50 different specialty services that we offer here, and I could probably speak a good 30 minutes on each one. So okay. We're really excited about what we're able to offer here with our team.
Well, thank you so much for joining us today. Ryan Solberg, Tahoe Forest Health System, talking physical therapy. This is Mountain Health Today. Thank you very much for tuning in. This is Mountain Health Today. I'm Ted Owens, your host, and this program is brought to you by the Tahoe Forest Health System. My guest host today is Dr. Brian Evans, the Chief Medical Officer of the Tahoe Forest Health System. Brian, welcome. Good to have you here.
Thank you, Ted. Good to be here.
For the folks at home, just a little bit of a background. You are Chief Medical Officer, so you're on the administrative side.
Yes.
But share with us a little bit about what you did prior.
Well, I'm an ER doctor by training, so I practiced emergency medicine in Western Nevada County for about 14, 15 years, and then I switched gears and ended up in administrative roles and joined the Tahoe Forest Health System about a year ago now, in December of 2022. So really delighted to be part of this system. There's unbelievably high quality care going on in the system, and really proud to be affiliated with it.
Well, we're going to spend a little time talking about orthopedics, and that's something I think the folks at home, many have experienced the need for orthopedics. And certainly as an ER doc, you've seen what people can go through that might lead to orthopedic attention. So tell us a little about the orthopedics program at the Tahoe Forest Health System and the team.
Well, obviously the area that we're in, the North Lake Tahoe area, there's unbelievable recreational opportunities, but with that comes injuries. And because we see injuries in skiing, snowboarding, mountain biking, and many other things, we have assembled really an unbelievably good orthopedic surgery team, certainly including the orthopedic surgeons themselves, who are very skilled, have to deal with a very wide variety of trauma issues, but also a huge variety of elective orthopedic issues, basically like arthritis and many other things. So they have an extensive skill set, but the entire team around the surgeons as well is very, very good. We have physician assistants, we have technologists, we have a nursing team, we have a therapy team, we have really tremendous breadth. So it's become really a center of excellence for people to come to, that if they need an assessment of a bad hip or if they injure themselves out on the ski slopes, we have the expertise to deal with that.
Let's go to technology for a second, because you and I have talked about this before, but they have tools available to them to assist in what they do. It is very rare in a rural environment, and,
Yes.
and actually some of the technology may not exist west of here. So tell us a little about that.
They have robotic surgery for joint replacement surgery in the operating room at Tahoe Forest here in Truckee.
That'd be the Velis Robotic Assist.
Velis Robotic Assist, yeah, absolutely. And it's a really elegant way to very precisely determine where to essentially make the incisions and put the implants into patients. So very, very helpful for the surgeons. Like you said, rare to have that in a rural environment. We also just put in a 3 Tesla, which is a very high grade MRI device, which is honestly, the community should be very proud that we're able to offer that. So there's really nothing that you could get somewhere else that you need to go to, more urban area for. You can get the care that you need right there in Truckee.
And I also believe the Tahoe Forest Health System orthopedists were the first in the region to perform anterior hip replacements as well.
Right.
That's rather amazing.
Well, the skill set that we have in our orthopedic surgeons is phenomenal, and they each of them has individual specialty focus, but they all can provide general orthopedic surgery for a wide variety of trauma and other conditions.
Now, to access an orthopedist, it's not something you can just dial up and walk in. How would somebody that thinks they might need to see orthopedics professional, how would they access that? Where would they go? Where would you recommend?
There's a couple different pathways. One is certainly if somebody's hurt and they end up in our emergency department or one of our urgent cares, they can be referred over to the orthopedic department, or in some cases the orthopedic surgeon. Right? Yeah, or the surgeon will be called in, depending on what's going on. But many of our patients are referred to an orthopedic surgery clinic, and that can be done through their primary care physician. And then patients can make an appointment through our access center. They can just go to our website, tfhd.com, and call the number and then explain what's going on, and they can get an appointment that way.
Let's talk a little bit. You had mentioned the emergency type situation.
Yeah.
Trauma 3. What does that mean for the folks?
We are a level 3 trauma center now. So through the work of some incredibly high energy people, very bright people with a lot of vision, Tahoe Forest has now been deemed a level 3 trauma center by the American College of Surgeons. It's a very high bar, and what it allows for is that our center now has people that are available 24/7. There's equipment, there's capacity, there's protocols, there's affiliations that mean that we can take care of trauma patients at the highest possible level. So certainly that includes orthopedic surgery, it includes other traumatic things like head injuries and things, but we're very proud to be able to offer trauma services to our patients in Truckee.
And I would imagine that given the types of activities that we all engage in up here in the North Tahoe area, mountain biking, rock climbing, skiing, snowboarding, whatever it may be, having the high skill set orthopedic department that you have is a key to being a level 3 trauma center.
It absolutely is, and our community has many people who are very high level athletes, and as they get older, they want to remain so. They want to continue to have high performing lives.
Yeah,
and
that's
they want
part of the dream.
Yeah. I'm not doing that. I'm in my 50s now. I just want to sit around and watch ESPN. That's all I want to do. But
cheese puffs.
Cheese
right?
puffs, yes.
Yeah.
But many other people actually want to ride their bike for 100 miles, or they want to keep skiing into their 80s, and I think that's awesome. And having the resources, if things happen, therapy services, but absolutely orthopedic surgery is critical. And we've got the best game in town.
Well, Brian, thank you so much for taking the time out of your busy schedule to talk to us a little bit about orthopedics at Tahoe Forest Health System. Really appreciate it.
Thank you for having me.
This is Mountain Health Today. I'm Ted Owens, your host. And my guest host today has been Dr. Brian Evans, Chief Medical Officer of the Tahoe Forest Health System. And we've been talking about orthopedics. Thank you again. But for you that have tuned in, thanks so much for doing so.